Well, here are the latest coronavirus numbers in Michigan. Another 1,100 cases, bringing us over 40,000 total. And another 103 people have died from the virus, bringing our death toll now up to over 3,600. Here in West Michigan, the death toll stands at 93. And until now, most who have died here have really been a statistic. But new tonight, we're learning about some of the 33 lives lost in Kent County. Our Target 8 investigators have gone through more than 24 death records, finding we've lost homemakers, business owners, factory workers, a teacher, and a retired fire chief. Here's Target 8 investigator Ken Colker tonight.
The loss of life has been felt here in southeast Grand Rapids and in other corners of Kent County, in places like Kentwood, Byron Township, Cascade Township, Sparta, and Cedar Springs.
Among the dead, Jim Bird, a World War II vet, part of the occupying forces in Italy and Greece, who served in the Signal Corps, which means he tapped out Morse code.
He was still very sharp.
He died in hospice just last week at 94, among the oldest that COVID-19 has claimed in Kent County.
That could be the attitude of some people. Well, he was 94, but he didn't have to go like this, and he went so fast.
She still had plans with her dad. Church every Sunday, then lunch. Weekly dinners at Brettonwood Senior Apartments in Kentwood, where he lived.
Full of life, very vibrant, funny.
And for her New Deal Democrat dad, who grew up in the Great Depression and retired as a social studies teacher, a trip this summer to the Jim Crow Museum of Racist Memorabilia in Big Rapids.
We would have had probably, I don't know, 6 months to a year more.
Even with his underlying condition, a long-time heart problem. Target 8 obtained death certificates for 26 of those listed as COVID-19 victims in Kent County. They help tell their stories and the worst part of the virus's story. The average age, 78, but there were more in their 60s than in their 90s. Among the youngest, 61-year-old Henry Janak, who lived with his wife in Cascade Township, the owner of a veneer shop, an avid golfer, father of 3, grandfather of 3.
They called him Papa, Papa Hank.
He coached his son's Little League teams and practiced t-ball with his granddaughter in the front yard.
He was the first one to give you a hug after you struck out, and first one to give you a hug if you hit a home run. He was always there for us.
The last time John Janak saw his dad was at his daughter's baptism on March 8th. Later that month, it started with cold symptoms, which led to gasping for air and to a ventilator at Spectrum Health Butterworth. Nobody knows how he caught the virus.
He may have touched the wrong gas pump, that someone may have had it and left a print on it or something like that. Or if he went to the grocery store and walked down the wrong aisle of someone that just sneezed and maybe he caught it like that. At that point, I wasn't concerned about him losing his life or struggling with it. It's just something that I knew he was young. He didn't have any underlying symptoms that. Hey, it's going to be a couple days, he'll recover, And
On Good Friday, Janak called his wife from the hospital.
He said, Sue, I know what's happening. I'm aware of what's going on. I'll be home soon.
The next day, abdominal bleeding. A week later, a nurse called the family, put them on a speakerphone to his hospital room.
I got to share a couple words with him before he had passed. He did hear us. He did know we were with him. And
21 of the 26 victims whose death records we obtained had pre-existing conditions, but as many as 5 did not, those records show, including Janak, though his son says he did take meds to control his blood pressure.
It happened to my dad, who was the strongest person that we knew and the strongest person that everyone knew. It can happen to anybody.
Health experts say the elderly and those with underlying conditions are still most at risk.
Unfortunately, the virus does not only impact those who have underlying conditions, those individuals who have passed away, who are otherwise relatively healthy. The virus can ravage their systems and their bodies. And unfortunately, we've seen that where people who are otherwise relatively healthy have died from the virus.
Records all show that while the virus has hit blacks and Hispanics hardest, most of those who have died in Kent County were white. Perhaps the health department says it's because more whites are living in the hardest hit nursing homes. 18 of the 26 lived in nursing homes or homes for the elderly. 10 at Metron of Cedar Springs, 4 at Bretton Woods in Kentwood, and 3 at SKLD on the East Beltline. Grand Rapids City Commissioner, the Reverend Nathaniel Moody, who owns Brown's Funeral Home, says he believes COVID-19 has claimed more black lives in the city than we know.
This plague, virus, whatever we want to call it, is having a profound effect on the African-American community, no matter where they are. We believe that there are more cases that we have buried that had COVID-19, but there were no testing to prove it.
Also among the dead, a Vietnamese husband and wife in their 70s who lived in a Kentwood mobile home park and died 3 days apart. On April 10th, nurses and doctors wearing masks lined the hallway and cheered as Catherine Yaw was wheeled out of Metro Hospital, a COVID-19 survivor, the Grand Marshal of her own parade. The 79-year-old grandmother of 27, great-grandmother of 43, and great-great-grandmother of 3 had fought off bouts of bronchitis and pneumonia for years, but this was as close as she had come to death. Nobody can say how she caught the virus.
With all of her health conditions, we thought it really was a miracle that she survived. We weren't expecting her to, and she did.
On Easter Sunday, after her move from the hospital to a rehab center, she stood in her room window and waved at grandkids and great-grandkids with signs outside. No visitors allowed.
That was hard because everyone was so used to seeing her on a daily basis that when she was in the nursing home and she most needed that comfort, because that's the kind of grandma she was. Come sit up on my lap, you know, come lay with me, come cuddle with me. And, you know, and you're not able to do that for her when she needs it. That's hard.
3 days later, family joined a conference call with a nurse holding up a phone to Grandma's ear. She had suffered an apparent stroke.
We all got to say that we loved her before we got the news that she was gone.
They live-streamed her funeral.
This is serious. Just because it hasn't affected you yet doesn't mean that it won't.
Kent County Health Department says it still expects the virus to peak sometime in mid-May. In Grand Rapids, Ken Kolker, News 8.
Ken has been working to put faces to as many of the victims as possible. You can read more right now on woodtv.com.